I now recognize Ms. Ross from North Carolina for 5 minutes of questions.
Thank you, Mr. Chairman, and the ranking member, and thank you so much to our witnesses for joining us today. Your agency's tireless work over the past 4 years allowed us to overcome the COVID-19 pandemic and its devastating impacts on the health and the economy of our nation. I'd like to discuss these efforts in a bit more detail so that we can continue to identify essential lessons for ongoing work of pandemic prevention and preparedness. I'm not going to ask Dr. Tabak about the NIH's work on the vaccine because I think that's been covered, but I would like to again remind everybody that according to one estimate, the COVID-19 vaccine has saved more than 3 million lives and prevented more than $18.5 million hospitalizations. But I would like to turn to Dr. Marston about how the FDA has continued work to review and approve updated COVID-19 vaccines to help keep Americans safe from new variants as they go about their day-to-day lives.
Thanks so much for the question. We have been working in concert with the CDC and their surveillance systems to understand the viral evolution and its potential impact on vaccine-related immunity. We have, on a regular basis, had our advisory committee meet and look at that information, advising us on what the composition of an additional vaccine should be. We have seen in repeated studies that those booster immunizations are important and that they are saving lives. One study in Denmark, for example, showed that individuals who had gotten a boost at the time of the XBB variant had 1/4 the rate of hospitalizations of those who did not. Very important public health intervention.
Thank you very much. And moving to the CDC, we know that the CDC played an essential role in the rollout of the COVID-19 vaccine, which got hundreds of millions of shots in arms and amounted to the largest vaccination campaign in our nation's history. Of course, we need to encourage people to get those boosters now, too. So if you haven't gotten your booster, please get your booster before the holidays. But Dr. Walk, how did the CDC work on the COVID-19 vaccine campaign and use that campaign to reach into communities to allow us to reopen as quickly as possible?
Thank you for the question. 80% of CDC's funding from Congress on the domestic side goes out to states to build state and local infrastructure and preparedness. Those states actually do a risk assessment and try to identify those populations that are at greatest risk when there's an emerging threat. They also do a number of different exercises to try to distribute that last mile of medical countermeasures. And so we activated those state and local relationships and that infrastructure to try to distribute the COVID vaccine. We also did a lot of work, as I've talked about before, related to vaccine effectiveness, and that was another key role, real-world effectiveness that CDC played. We did see that it was difficult to reach some populations more than others, and so understanding where those communities at greatest risk were, who were being affected, who were hard to reach, really that relationship between local and state health departments with CDC was invaluable to try to identify those pockets where vaccine was not being distributed and then to quickly try to rectify that situation.
Thank you for that, and I clearly saw that in my home state of North Carolina, and now, of course, we have Dr. Cohen at the CDC. I also want to express how grateful I am for the CDC's efforts to take lessons learned during the pandemic through the Moving Forward initiative and use them to inform future-oriented policies that will leave the country better prepared for the next pandemic. To ensure and continue these critical preparedness efforts, Congress must act to provide additional additional support to our public health infrastructure. While public health emergencies can trigger critical supplemental funding for agencies, the funding structure is not conducive to preventing future pandemics. For example, CDC jump-started an innovative wastewater surveillance program during the pandemic through the use of emergency supplemental funds. Once this funding dries up, the agency will no longer have the resources to continue this program. We must ensure that tools like this are fixtures of our public health strategy rather than waiting for emergent situations to implement them. Another key area that the CDC has focused on is improving our disease testing infrastructure. To enhance these efforts, Congress must act to improve the supply of medical laboratory personnel, a profession that played an indispensable role during the worst days of the pandemic and is currently facing a serious workforce shortage. I proudly introduced, and Dr. Barra has joined me in it, the Medical Laboratory Personnel Shortage Relief Act of 2024, which would do just that. It's clear that Congress can take steps to complement the tremendous efforts made by our public health agencies to ensure that we're ready for the next pandemic. Thank you, Mr. Chairman, and I yield back.